Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Jeffrey Hatef. He's a neurosurgeon, and today's KevinMD article is Guilty Until Proven Innocent, My Experience with a State Medical Board. Jeffrey, welcome to the show.
Thanks for having me.
All right, so I think your story is articulated in your article, so why do we start from there? Just tell us a little bit about yourself and then your story that you shared with us on KevinMD.
Well, I'm a neurosurgeon, been practicing for just a couple of years, finished residency in 2022. And the story I shared was about my experience with our state medical board. I was summarily suspended in February of this year and sort of telling the story of how what's unfolded after that. Initially, I knew that some complaints had been lodged. I didn't know by whom, but there were multiple of them on multiple different patients. And I've since learned that it was an old colleague who was dissatisfied with me. But the summary suspension just kind of came out of the blue. They came to my house and served me with this suspension, and I just had no idea where this had come from. I mean, judging from what I wrote in the article, there were patients and they did have bad outcomes, but I didn't think that there was any sort of malpractice or issues with the standard of care. So shortly after the suspension came, I obviously got a lawyer. We started our defense. We got subpoenaed our own records, and we soon found out what happened. And that was that the medical board had subpoenaed incomplete records. They had really only subpoenaed and reviewed just a few days of care focused right around the surgeries, and they didn't see the entirety of the care. For all of these patients, I'd known them for many months. For the two patients with the bad outcomes, for 6 months plus. And initially, there were three patients on this complaint form for the suspension. One of the patients, what the state's expert, what the state medical board had said was essentially the whole procedure was unindicated and unwarranted. And that patient, they only had, very brief, the first hospitalization. I had done a staged procedure on him. And he actually, even at the time of the suspension, he had completed his surgeries. He had completely recovered, and he'd gone from being, on 30 to 40 milligrams of OxyContin a day to being off pain meds completely. It was really a great success. So, through my defense team, we're looking at these records and we're saying, this isn't right. What happened? And now we know they just had incomplete records. But we still had to go through the process. We got our own experts. Four different experts all agreed with me that there were no issues with the standard of care whatsoever. And we sort of submitted this information to the board when it was required according to the timetables. And I anticipated that they would probably just dismiss the case. I mean, it was 4-1. There was this error of the records, but we never anticipated what they actually did, which was sort of vacate the suspension and dismiss one patient, the one where the most egregious errors were made, the one who did well, and then resuspend me for the other two patients and kind of carry on as though nothing had happened.
So let me unpack some of the things that you said at the beginning. So you said that initially some of these complaints came from patients with bad outcomes, but then also there may have been initiated by a colleague that interacted with you in the past?
We know that now. Initially, I didn't know who was submitting these complaints. The medical board had been in communication with me and said, we have some complaints. And that's the way that almost all their investigations start, is through complaints.
Yes.
They, by law, they're confidential. They're not allowed to tell me who submitted the complaints initially. All the patients were discreet. Many of them didn't even have complications. It was really a random assortment of complaints, and I was quite confused. Now, and it's through the medical board that we know this. They were contemplating calling this individual as a witness, but I now know it's a former colleague who had left the practice, who was just submitting kind of complaint after complaint.
So you mentioned that during the medical board, one of the complaints was dismissed, but then the other two you were resuspended for. So tell us, when you were talking to your legal team, you mentioned that this was a complete surprise. So what was their reaction?
They were absolutely astounded. I mean, my lawyer's been doing this. He started with the medical board as a medical board attorney himself, 25, 30 years ago, whenever he got started. And he's been on the defense side for decades. And he said he's never seen anything like this. So we immediately had to bring it into the courts, which is it's where it's at now. But they said it's really unprecedented and unusual to say the least.
And from the medical board's perspective, what was some of the rationale behind their decision?
They didn't list any rationale or describe anything. If you look online, you're able to find some of these public record documents, and it really just says they at the board meeting they described needing to vacate the suspension, and they just go ahead and do it. There's not any discussion or rationale about it.
And in terms of the incomplete medical records that the board reviewed, what was the reason that it was incomplete? Was it just simply an oversight, or was there any reason why they subpoenaed incomplete records?
Well, at the hearing, we were actually able to call one of the main board attorney who investigated the case, and she did divulge that she just didn't know that my employer was not the hospital. My employer was a different legal entity. So, I did these cases at a hospital, but I was employed through a separate medical group that employs, a couple hundred physicians. And throughout the course of investigating me, I guess she just didn't know that. And they submitted the subpoenas to the hospital, but the hospital is only in possession of the hospital records. And so they didn't get the records they need. They the neurosurgeon who reviewed them, the expert witness, he knew they were incomplete and didn't tell anyone about that. But we presume that no board lawyers really read the records at all.
Mm.
They just sort of compiled them and then passed them off.
So you've been going through this ordeal. You said it started earlier this year. We're now speaking in October, so about 8 months, perhaps.
It's been 8 months.
So tell us what your professional life has been during that time.
None whatsoever. Suspended in February. And initially, I was placed on administrative leave because, part of the summary suspension is they say there's clear and convincing evidence, but it hasn't been adjudicated. I mean, I didn't have my say yet, my hearing. But shortly thereafter, some of the newspapers covered this, and then my employer decided to terminate the relationship. And since then, I can't practice medicine. I don't have a license. As physicians, we really don't have much training to do anything else. So
Mhm.
I've been occupying my time. We had a new baby. I've been coaching my kids' teams. I've lost some weight, things like that. But professionally, there hasn't been much besides keeping up with CME.
So before this incident, have you had any experience with bad outcomes, medical malpractice, patient complaints?
Never, never. Just the only complaints were now we know are through this individual. Had never been sued. No malpractice, nothing like that.
Now, as you reflect on this, and I'm sure you had a lot of time to reflect on this, is there anything you think that you could have done differently to avoid a situation like this?
Well, I mean, I could have not taken on the complex cases, but I don't think that ultimately that's the answer. When the complaints came in, and it's sort of like a board investigator who spoke with me, I I guess I presume that they would have a little bit more due diligence,
Hmm.
and maybe I shouldn't have had that presumption. I should have been a little bit more aggressive on my end with legal counsel ahead of time. But even with that, I don't know if anything would have changed.
You mentioned that physicians don't get a lot of training with this, and that's absolutely true. So tell me, what kind of support have you had, and what kind of support would you like to have had?
Well, I mean, I'm lucky to have a really good family. My wife has been completely supportive. She's a doctor as well, radiologist. And this is one of those things. It's not the most egregious accusation that the medical board could levy, but it was pretty bad. And I'm lucky that friends and colleagues have really been supportive. Part of the process of going through the hearing was getting letters of support from the community, and we were
Hmm.
lucky. 60 plus members of the community wrote letters of support, and that's not even including. I've since learned through some other people that the former employer was really discouraging anyone from speaking out. So most of my colleagues in the medical group weren't able to write letters of support when I know that they would have, and many of them had very close relationship with me. Legal wise, there's no training whatsoever.
Hmm.
I consider myself someone that has an interest in this. I've written some papers on medical malpractice issues when I was in residency and kind of had an interest in legal aspect, and that's let me work well with my attorney, kind of understanding some of what's going on, but I never anticipated something like this happening.
So currently, the case is tied up in the courts. Just outline what are some potential paths forward.
Currently, the legal aspect of that resus that they did is in the courts. The merits of the case are working their way through the medical board process. We had our hearing. The hearing examiner recently produced a report, and this coming Wednesday, actually, so I believe it's the 8th, at the medical board meeting, it will be decided.
And from what you anticipate, is there a possibility of a favorable outcome? Is it 50-50? What is your legal team preparing you for the potential outcomes?
What the what the hearing examiner said was that his opinion was that one of the patients was within the standard of care, one of the patients was not, and he recommended a reprimand, basically the very most minimum fine and most minimum punishment. What we think is that there, these issues with the process of the medical board, and also some of the issues with the board's expert himself, really were not well accounted for by the hearing examiner, and we think the board members themselves, the voting members, are likely to pay a little bit more to that. Now, is it going to be a dismissal? I don't know. I hope, and that's what I think is the just outcome. But ultimately, we'll have to wait and see.
So through this whole ordeal, tell us some of the things that you've learned about medical board politics and the patient complaint process that you didn't know before.
I think the main thing I've learned is that, at least in our state, if you imagine this like a criminal scenario where there's a prosecutor and there's grand juries and judges and there's kind of a lot of people at play, in our state, there's the board staff, and there's two board members who are the investigative members. That's the secretary and the supervising member. And they're the ones who make this determination that I should have been summarily suspended. They're the ones who made the determination to vacate the suspension and resuspend me. The other board members aren't able to review any evidence until now, until the case is over. So it's really a lot of power that's entrusted in just two individuals without any other checks, so to say.
And these two individuals, do they have training in what you do
They're
in
they're
neurosurgery?
both physicians. No, they're not neurosurgeons. They're both physicians.
And in one of the cases where they said that what you did fell outside of the standard of care, are you at liberty to talk about more details and whether you agree with that assessment?
Everything is public record. We just can't use patients' names. So anything we can talk, anything that you'd like to talk about, I think we can.
Sure. So tell us about the clinical case where they accused your conduct as being outside of standard of care.
The first one was, but both of them were elderly ladies with spinal issues. The first one was in her late 70s, and I'd known her for some time. She had undergone a previous spinal surgery that for a spinal fracture that did not stabilize the fracture. And so she had an unhealed fracture, and she was developing spinal stenosis at that level. And I first met her in spring of 2024. And at that time, she was in pain, but she was walking. And over the course of about 6 months, it became progressively more painful, progressive more deformity. And ultimately, she presented back to my office in a wheelchair. We brought her to the hospital and obtained pre-op clearance. And it was basically, this is a high risk patient. She'd had a minimally invasive heart surgery before. She had a left bundle branch block. She had a number of comorbidities. She was in a tough patient, a sick patient. But she had severe spinal stenosis, was barely able to move her legs. So we talked to her and said, basically, if we want to try to preserve ambulation, we have to attempt surgery. And I did the surgery with my partner. We had a bit more blood loss than expected, but even the state's expert agreed that every aspect of the surgery was within the standard of care. The blood loss, what I did, all of those things. The state's own expert agreed that was all to the standard of care. She unfortunately did have cardiac arrest shortly after we finished surgery. I mean, we finished it successfully, but her potassium was very high and she did have a cardiac arrest. So it was a bad outcome, a very unfortunate outcome, though not at all what I anticipated, not at all what I wished for, obviously. But it was really the rationale and kind of the argument that the board made that was confusing to me. Initially, they said that their experts said I needed to transfer to another hospital. And when we provided our reports, we were kind of like, that doesn't make sense. You know, I did 2 fellowships in spine deformity. I'm in the Scoliosis Research Society. This is what I do with my practice. I mean, I'm early in my practice. Don't get me wrong. I'm not the senior guy in the country, but it doesn't make sense that I would have to transfer. We're doing it at a major urban trauma center. After the state saw those reports, they basically changed their argument and they said, well, you didn't need to transfer, but you just shouldn't have done the surgery. Mm-hmm. No one should have done the surgery. Mm. And the state's expert even said, you know, worse things in life than being in a wheelchair, should have not done surgery, should have allowed her to progress to become paralyzed, which is just a really unusual, kind of goes against everything that you think about when you think about patient autonomy and medical decision making.
So you obviously shared this story on KevinMD. You're appearing on this podcast to share your story in your own words. What's the goal of sharing your story? And from the other physicians who are listening to you, what kind of message do you want them to come away from hearing from you?
The goal of sharing the story is just that, to let people hear what's happened, hear what's continuing to happen. I really feel like I've been treated unfairly and unjustly. And, you know, I have all faith that the board members are going to make things right come next week, but just getting the story out there. I think what recommendations I would make to people, it's hard to, if you're going to take on cases like this, you know, frail old patients who have comorbidities but are facing paralysis. Unfortunately, you know, we all know in neurosurgery, it's such a high risk field that not everything is going to go well. Not every field has those risks, but neurosurgery, we know that very well. I mean, not every case is going to go the way you hope. So the question is, do you not do these for fear of the medical board? I don't think that's fair to patients. You know, I have faith that the system is going to make things right and that the right answer is going to come down. But ultimately, I think that you have to do what you believe is right for the patient.
We're talking to Jeffrey Hatef. He's a neurosurgeon. Today's KevinMD article is Guilty Until Proven Innocent, My Experience with a State Medical Board. Jeffrey, let's end with some take-home messages that you want to leave with the KevinMD audience.
Just that, what I was just speaking about, which is always keeping in mind for clinicians to do what's right for the patient. Keep that in mind first and foremost. And then what happens afterwards, you can deal with it. Like I said, I have faith that things are going to be made right and the just outcome is going to come down, but we'll take it one step at a time.
Jeffrey, thank you so much for sharing your story, time, and insight. Thanks again for coming on the show.
All right. Thank you.